My name is Manusree, and I'm a fourth year medical student at Texas A&M University College of Medicine. And today I'll be presenting about the outcomes of our communication-focused team-based patient care program. So effective communication among healthcare clinicians is very essential for delivering high quality care for patients. There are studies that show the importance of physician-patient communication, but there is more data that's needed surrounding the impact of having a structured communication program that involves all levels of the healthcare staff. So in this study, we address that gap by evaluating the patient experience and other operational metrics like clinician productivity, length of stay, and hospital readmission rates of a structured communication improvement program that was implemented at a healthcare facility. So for the methods and design of our study, for the communication enhancement program, we focused on three main educational methods for our healthcare team members, which included one-on-one coaching, individual accountability, and having learning sessions with the whole team. Meetings were held at the hospital with all levels of the healthcare staff and different educational formats following different time intervals. And we measured these outcomes with the HCAHPS survey, which is also known as the Hospital Consumer Assessment of Healthcare Providers and Systems. And we use the patient communication scores from this to measure patient experience. And other data collecting instruments that we used included the length of stay and readmission rates. Going more into the results of our study, our primary measure that we used was the patient experience scores, which we calculated by aggregating the top box responses from the doctor communication domain specifically within the HCAHPS survey. Prior to the program implementation, the patient experience scores was only 60.44%. But after the program implementation, we saw that the patient experience scores actually increased to 79.42%. So in this figure here, I don't know if you guys can see my pointer. But in figure one here, we see how the patient experience scores changed throughout the study. So in the pre-implementation period, which lasted around 18 months, we see that the patient experience score average was 60.44. And in the post-implementation period, we see the scores start to trend up and went to an average of 79.42 in the second 18 months of the study. With regards to secondary quality measures, we also looked at the length of stay, patient encounters per clinical hour, and 30-day all-cause readmission rate. So the figure 2 over here at the bottom left corner looks at the length of stay. And prior to implementation of the program, the length of stay was 4.6 days, but this went down to 4.1 days after implementation. And then also looking at the 30-day all-cause readmission rates at the top right corner, this figure shows prior to the program implementation, there were more readmissions happening. The readmission rate was 6.813%, but after the program implementation, this went down to 5.385%. And this table here just summarizes all those results. Going more into our discussion, as I mentioned earlier, our primary quality measure in the study was the patient experience scores. And the patient experience scores actually jumped quite a bit, like almost 20% after implementation of the communication enhancement program. The doctor domain of the HCAHPS survey specifically looked at respect, listening, and clarity of explanations by doctors. And when site leaders were interviewed about this, they noted that some tactics that really helped were shadow rounding, reflective listening to express empathy to patients, and nonverbal communication skills like making eye contact. And that makes a lot of sense because the survey, that section of the survey is also looking at specifically like if the patients felt heard, and these nonverbal communication tactics play a role in that. So in conclusion, this program demonstrates how having a structured communication enhancement program can cause direct improvements in patient experience and also secondarily reduce length of stay and lower 30-day readmission rates. The framework can also be adapted based on like local available resources, specific hospital staffing models, and future studies should explore the scalability and long-term sustainability of having similar communication enhancement programs. Thank you.
Thank you, Manusree. Great job. So our question for you is, what are the next steps for this project in kind of expanding across the system or other hospital systems in your area?
Currently, I don't know of any active plans that are in place because this was kind of like the first time that our team has done something like this. But we do plan to like do more research into like trying a different hospital system with different needs. This one was specifically a hospital in Texas, in a smaller sort of town. So the next scalability wise, we could maybe look at like what that would look like on a bigger scale at a bigger facility.
Absolutely. Thank you so much.
Thank you.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.